My name is Kate Fisch. I'm the Associate Vice President of Clinical Services for the Odyssey Eating Disorder Network. OSFED stands for Otherwise Specified Feeding and Eating Disorder, which is a mouthful, which is why we call it OSFED. And this is a pretty common diagnosis, and it really is a catch for individuals who are struggling in their relationship with food and their bodies, but don't necessarily meet all the criteria for either anorexia, bulimia, or binge eating disorder. And that being said, it's really important though to remember that OSFED isn't less severe or less in need of treatment. It can be just as debilitating and impairing as anorexia, bulimia, or binge eating disorder. So some examples would be like atypical anorexia. So rather than meeting criteria for anorexia, an individual who has lost a great deal of weight, but is still within their ideal body weight range, this would be considered atypical anorexia. It doesn't necessarily meet all the criteria for anorexia, but it's still in need of treatment, and it is still a disordered relationship with food. So OSFED then is treated very much like we would treat anorexia, or bulimia, or binge eating disorder. Of course, we're going to be using evidence-based practices such as therapies that are designed as eating disorder interventions, cognitive behavior therapy, dialectic behavior therapy, acceptance and commitment therapy. And we are also going to tackle OSFED with that treatment team approach. So we're going to incorporate the dietitian, there will be medical oversight, there will be group therapy, and then an individual therapist as well.